Hello and welcome back. Today I am going to talk about salt. Is there a better salt than sodium chloride to reduce blood pressure? Let us find out in this video. I read several articles and research publications related to this topic. And these publication and research talk about the salt alternative. So before we talk about the salt, let us look at the prevalence of hypertension or increased blood pressure. World Health Organization estimates 1.28 billion adults aged 30 to 79 years worldwide have hypertension, and 2/3 of them are living in low middle income countries. Hypertension is a major cause of premature death worldwide. And the link between high blood pressure and salt is well established. Excess salt or sodium increases the risk of high blood pressure. Hence, people with hypertension is advised to reduce salt in their diet. So, what is the solution? A simple and effective solution, that is switching to potassium-enriched salt. There is not much difference in taste or look compared to the regular salt. A research just published says guidelines for hypertension should provide recommendation to switch potassium-enriched salt. So what is this potassium-enriched salt? So in potassium-enriched salt, it replaces some of the sodium chloride in the regular salt to the potassium chloride. So it tastes and looks similar to regular salt. Other names are potassium salt, hard salt, mineral salt or sodium reduced salt. So how potassium enriched salt lower blood pressure? It reduces sodium intake because some of the sodium is replaced by potassium. Usually 75% is sodium chloride and 25% is potassium chloride. And potassium enriched salt help to increase the potassium intake. Insufficient potassium is another big cause of high blood pressure. So there is strong research evidence suggesting that this is helpful in high blood pressure. So strong evidence coming from randomized control trial of 21,000 people showed switching to potassium enriched salt lowers blood pressure and reduces stroke, heart attack and early death. Another overview, systematic review of 21 studies suggests that people could benefit from potassium-enriched salt. So the WHO Global Report on Hypertension, which is published in 2023, suggests that potassium-enriched salt is an affordable strategy to decrease blood pressure and prevent cardiovascular events such as stroke. So what is the current advice? So this particular article is published recently, January 2024. So this article talk about 32 clinical guidelines they reviewed across the world, and this is published in Journal of Hypertension. So the key findings are most guidelines didn't give clear and consistent advice on using potassium-enriched salt. Only 2 guidelines, the Chinese and European guidelines, currently recommend using potassium-enriched salt. So since it is published in 29th January 2024, we know that it is one of the latest publication on this topic. So what the authors recommend is the guidelines should have strong recommendations for people with hypertension. So potassium-enriched salt with a composition of 75% sodium and 25% potassium chloride should be recommended to all patients with hypertension unless they have contraindications or kidney diseases. And also the guideline should recommend that recommendation for general population as well, because this is beneficial for general population. So who should avoid potassium-enriched salt? I already mentioned people with kidney disease, people using potassium supplements, and people with high risk of developing hyperkalemia or increased potassium levels and other medical contraindications to potassium, those people should avoid this potassium-enriched salt. So now the question is, why do so few people use it? Why it is not common? Why it is not widely used? There are three main reasons: lack of awareness, limited availability, and more costly than regular salt. My last point is it possible for a worldwide salt switch? Can we make it happen? We have seen already a worldwide switch in the last century, that is to iodized salt. That is considered as a major public health achievement and had tremendous health benefits. Similarly, the next switch to iodized and potassium-enriched salt offers the same potential and several health benefits and global health gains. But lot of effort is required to make it happen. So with that, I would like to conclude this video. Thanks for watching. Please like, share and subscribe. Thank you once again.